Hey guys, Dr. Davin Lim, board certified dermatologist. So today's video is why you should use vitamin C. So in the beginning of the video, I'll talk about vitamin C as a whole, and then if you stick around, I'll teach you how to use it like a dermatologist. So guys, when you look at the vitamins, it's really easy to understand. So for the things to work, the vitamins to work, it's A, B, C, D, E, F, right? So these are the skincare. So vitamin A is your retinol, vitamin B is your niacinamide, vitamin C is your ascorbic acid, vitamin E is your tocopherol, vitamin D is basically used by dermatologists to help reduce inflammation but also modulate the amount of cellular turnover your skin has, and vitamin F, it's not really a vitamin, but it's called ferulic acid, which is a very potent antioxidant. So vitamin C is one of the top 3 vitamins that we recommend. Now, why should you use it? It's because it has a multitude of uses. It's relatively inexpensive to buy and it does work. So first of all, how to use it and what to look for. Vitamin C, the best form of vitamin C is called L-ascorbic acid. The concentration you should be looking is between 10 to 20%. So should you DIY and make your vitamin C? My answer is no. So unless you're a genius like Michelle Wong, who is a formulator and who knows their biochemistry backwards, Dr. Wong can do it. My suggestion is that for the average punter, it's pretty hard to get the formulation right. So for all of us out there, I think that buying vitamin C, a good preparation, is very important. Should the concentration matter? So the bioavailability is the amount absorbed to actually give you a change in your skin. So the bioavailability for higher concentrations like that may not be as good as something as a lower concentration. There are many things that come into play, including the formulation, but also most importantly, the pH of the vitamin C or ascorbic acid itself. And now a brief word from our sponsors. So another anti-aging strategy I practice is my sleeping position. It's really important. We all know the importance of quality sleep for our skin and our overall well-being, but achieving it can be quite a challenge. While sleeping on your back may seem to be the ideal position, it's not always feasible for most people, and it can even worsen snoring and obstructive sleep apnea. So what's the secret to a good night's sleep without causing sleep wrinkles? So guys, I found a perfect solution is the Sleep and Glow Omnia pillow. I use it, it actually does work. The pillow's 3-dimensional design specifically supports the upper and mid face, reducing the compressive forces on your skin whilst you sleep. By decreasing mechanical compression, it minimizes the development of sleep wrinkles as they are primarily caused by this pressure, not dynamic wrinkles. Want to dive deeper into how it all works? Let's break it all down. This is me on a normal pillow. Notice the compression of my mid-face and forehead area. It's normal biomechanics associated with sleep. The compressive forces act in a perpendicular vector to the expression lines. These same lines are resistant to Botox and anti-wrinkle treatments, whilst in some areas, dermal fillers are classed as high risk. Moreover, the pillow has an orthopedic effect. This ensures correct anatomical position during the sleep. I personally enjoy the relaxing sleep that I have with my Omnia pillow. Even my colleagues at work actually love the pillow because it's great for post-procedures. They've also kindly given me a discount code, 101SKIN, and this will give you 15% off site-wide until November 24th, 2023. They don't discount often, so if you've been thinking about it, it's definitely time to give it a go. So guys, why should you use vitamin C? Simple reasons. Number one, it is an antioxidant, so you can incorporate it in your morning routine. So something like vitamin C, ascorbic acid, 10 to 15% can be used as a standalone underneath your sunscreen. And what that does is that it acts as an antioxidant. Antioxidants scavenge free radicals, in other words, molecules which are produced by UV or even environmental pollution, which can damage your DNA. So that's the first thing, is an antioxidant. You can boost that up by adding vitamin E and ferulic acid. So remember, with your vitamins, your E and your C. So there are certain brands like SkinCeuticals have a good formulation of vitamin C, E and ferulic acid, which they call CE ferulic acid. Go figure. Certainly, if that's beyond your budget, there are a lot of other cost-effective brands out there that you can choose that's well formulated for your skin as well. So vitamin C in the morning acts as an antioxidant, it's a protectant, it's the second layer of defense after your sunscreen. All right, now what can vitamin C do at night? Vitamin C is essential in the formation of collagen. So vitamin C can help synergistically with things like your retinol, your retinoids, and help stimulate collagen or form collagen itself. Can it be used together? Well, there's no hard and fast rule, but if you're a beginner to skincare, probably separate your vitamin C use at night compared to your retinol. The good thing with vitamin C, especially when you're using a good formulation, is that it hangs around in the upper layers of your skin or your epidermis for a long time, upwards of 36 to 72 hours. So you may have a morning routine that's got a good formulation of vitamin C that can have the residual effects at night. So it doesn't stop you using your retinol or your retinoids at night. So the second thing, as mentioned, collagen repair. The third thing, which is really important, is pigmentation. So vitamin C can be used as an antioxidant to stabilize your certain creams that may oxidize. So for dermatologists, we use vitamin C between 0.5 to 1% in something like your hydroquinone because it stabilizes hydroquinone, making the more active ingredient more powerful and lasting longer. That's the first mechanism. The second is that vitamin C is also a very potent inhibitor of your enzyme called tyrosinase. Tyrosinase is the enzyme which makes melanin, which in other words makes color. So vitamin C at around 10 to 20% is a potent inhibitor of tyrosinase. So that's how we use it in pigmentation disorders, including treatment and prevention of melasma. Now, who can't use vitamin C? Basically, if you have sensitive skin, because of the low pH formulation, you should be cautious. So patients with something like eczema, seborrheic dermatitis, rosacea, sensitive skin or sensitized skin should be cautious when using vitamin C. So what you might want to do is a test spot, take a tiny bit with a good serum, place it on one area, see how that goes over the next 24, 48 hours, and if you can tolerate that, increase as tolerated. So once again, with all of these rules, it's not a hard, fast rule where if someone has rosacea, you can't use vitamin C. You may have to modulate the dose, you may have to use a better formulation, a better serum, but also start gradually, increase as tolerated, and know what to do and back off if you get any skin inflammation. So guys, I hope you liked that video on vitamin C. It's one of the essential things to add into your skincare routine. For me, when it comes to treating pigment, this is usually number 2. I try to add that with your other tyrosinase inhibitors, generally speaking in the morning as an antioxidant, which also helps in build collagen at night because of the longevity. Keep it simple, keep it real. See you later.